Why can't dentists just talk like normal people? Okay, hello everybody. It's finally time to shoot my Dental Heroes video. My name is Steve Mautner, also known as Morty on social media. So I've been a dentist for 33 years. I'm come from a family of dentists. My dad was a dentist, my grandfather, my uncle, and my mom was also a hygienist, and so was my aunt. So I kind of grew up around this stuff, so it looked like a good career. So the money was good, and I liked the independence it afforded us, so I chose it. And so far it's worked out, despite many annoying situations. First question that you guys want to know is, what are the pros and cons of being a dentist? The pros are many. The income is good. You get to work when you want, on who you want, and you can take time off whenever you want, and you're well respected, and you could have a nice life. The cons are the physical toll it takes, and of course dealing with people, which is very difficult, and also the fact that there's always the looming threats of lawsuits and board complaints, which could hurt us financially. The best patient experiences are actually when they pay me and they just leave the office. To me, that's a great experience. So I've had that happen many times. As far as best patient experiences, I do enjoy when we do a full mouth implant case and we take someone with a full denture and we convert them into maxillary and mandibular fixed bridges. That to me is a great experience. Tips on experiences with dental procedures. Okay, my number one tip is, first of all, learn how to work fast. Use core spurs, and another tip that's a must is stop giving inferior alveolar blocks. They don't work, and they create lip and tongue numbness, which is very annoying to the patient. Plus the added potential complication of nerve damage or trismus, or just the difficulty of shoving a needle way in the back of someone's throat. So I give I use infiltration, and then I give a PDL injection with a Ligajet for mandibular teeth that I'm doing root canals on or extractions. And I always use Septicane also. When someone says I'm allergic to epinephrine, I nod my head and then I whip out the Septicane, because it's more important to get anesthesia than it is to worry about someone's palpitations that are momentary. You should never say to your patient is, we don't take your insurance. Take their insurance, because if you don't take it, someone else is going to take it, and you're going to lose a patient. Why do dentists use dental terminology? I have no idea. Why can't dentists just talk like normal people? I don't use dental terminology. When someone needs an extraction, I say we need to pull that tooth. When someone needs a crown, I will say crown, but I sometimes use the word cap, because people understand the word cap. And if they need a denture, I say you need a denture. Very little dental terminology. Unless someone is really, they seem to be an educated person and they want to know the details. Normally it's a quick non-jargonish explanation so they can understand. My most frequent dental terminologies that I use are, I have to give you a shot, and you need a cap or a filling or an extraction, and would you like to start now? That's pretty much my typical dialogue during the day. You dental students, you want to know our biggest challenges? My biggest challenge, I would say, is dealing with unrealistic expectations and patients who rush me, and also the patients that don't want to pay. Dentistry is, for me, it's a worthwhile career, because very few careers enable you to earn more when you work harder. If I want to make a few extra bucks, I'll squeeze in a crown or I'll work through lunch. Very few careers enable you to do that. Also, I take all holidays and weekends, and if I want to leave early, I leave early. How many people have that kind of choice in life at their particular jobs? So anyway, I'm Steve Mautner. My practice is in Margate, Florida. if you're interested in checking out my practice details, my website is sgmdds.com, and let me know how it is, because I haven't looked at that website in about 2 years. So if you don't like it, let me know. Okay, it's been fun.